Welcome to today's edition of Mental Health Matters. Today's topic is dementia. I have Laura Wayman on the show today, and she's going to talk about the best way to approach dementia care. Stay tuned. Laura, thank you so much for taking the time out of your busy schedule for being on the show today.
Thank you, Jesse. I am just so honored to be here.
Oh yeah, and I'm honored to have you here. This topic is so needed in today's time. So many people, as you know, is dealing with dementia, whether it's a family member, dealing with it on the caregiving side, or the loved one that actually have this dementia. So I know you have a lot of knowledge to share today. So we're gonna just jump right into it. Why don't we start off by you just introducing yourself and we'll go from there.
Okay, well, once again, I'm Laura Wayman, also known internationally now as the Dementia Whisperer, and I am a dementia care expert.
Yes.
It's a very unusual field. There's not a lot of us, but this is an issue that we have not had much of in the past because we haven't been living as long. So I want to help our audience today understand dementia in a very deep and concise way.
Yeah.
Have a perception that they probably haven't heard before about what dementia is, how it affects that person, and is it really a mental health issue? Is it a mental illness? So let's talk about that today, Jesse, because I feel like the world should be dementia aware.
Yes, absolutely. So let's start off by I'm going to ask you, what is dementia and why is it different from mental health, or is it a mental illness?
Well, first of all, the word dementia has so many myths surrounding it. We don't use that word properly because the word dementia is actually a list of symptoms. It's not a diagnosis in itself. So it's an incorrect use of the word. If I were to say, Jesse, you have dementia, to make that correct, to make that make sense, I would have to say you are presenting dementia symptoms. So let's talk really quickly about what do I mean by symptoms.
Okay.
You understand, you've experienced symptoms in your life. For example, you've had the symptom of pain. Oh yeah. Right?
Yeah.
But I think you'll agree with me that you have to have something causing you to have the symptom of pain.
Correct.
Because the symptom of pain is your body saying something's wrong. So when I talk about dementia symptoms, we have to also recognize that something has to cause someone to have that. And there are over 100 different causes.
Wow.
So when people ask me, what's the difference between Alzheimer's and dementia? What I need them to understand is Alzheimer's is one of those 100 causes of loss of normal brain function, and that person's body is presenting that loss in all of these different symptoms because loss of brain function can happen in many different areas, and most of this loss, unfortunately, is permanent and progressive.
Yes.
So once it's lost, it's gone forever. And what is lost when I say loss of normal brain function is the brain function that we learn over our lifetime.
Yeah.
So we come home as infants with this basic brain and we have basic function, but over our lifetime we learn this learned brain function to enhance our use of the basic function. for example, an infant comes home and they can see, but they have to learn to process what it is they see, what it means to them, and how they're going to use that information. An infant comes home with the ability to hear, but they have to process what it is they're hearing, how to use that information, and so on and so forth. So every piece of data that we receive, we have to process, and then we have to access this brain function in order to use that information.
Yes.
So dementia is different than mental illness in the fact that a person with dementia might feel confused because they can't process. They might have loss of memory. They might have even physical dementia symptoms like loss of balance, loss of coordination, all of that. But these, unfortunately, are permanent, so we can't stop it, fix it, or change it.
Yeah.
Whereas some mental health matters, as you well know, are treatable. And with cognitive therapy, they can be changed or fixed.
Yeah.
So the difference is with dementia, we have to learn to manage it.
Yeah, because it's progressive.
It's progressive, and we can't stop it, fix it, or change it.
Yeah.
And that's very painful information to that family caregiver, but once they learn that the more they try and stop it, fix it, or change it, the worse they'll make it for that person.
Yeah.
And so it gets a bit more complicated than that, but basically the way I like to explain it, just to simplify it as much as possible, because it is really complicated, is to say somebody who has loss of normal brain function has a broken thinker.
Yeah.
And they can no longer think normally about information that comes at them.
Yeah.
So our job to become dementia aware is to learn to simply think for them.
Yeah.
It's just kinder, it's supportive, but it takes a little practice.
Yeah. So let's talk a little bit about the symptoms. So what are some of the symptoms that comes with dementia, where people can be on the radar to know that this possibly may be dementia related?
Yes, that's very important, because we have in our minds some idea about what dementia symptoms are, and they're different in everyone.
Yeah. Wow.
So a lot of times when I ask, if I'm standing in front of an audience and talking about this, presenting about what is dementia, I ask them, what does that word mean to you? What does dementia mean? And often they will say memory loss.
Yes, that's exactly what I was thinking.
Yes, and so I'd like you to all break the habit of thinking dementia is all about just memory loss, because there are many causes of this loss of normal brain function that never affect the memory portion of the brain.
Wow.
And so many people have very serious, debilitating dementia symptoms.
Okay.
And yet they remember everything.
Okay.
And so it can be a part of it,
Yeah.
but not always.
Exactly. Okay, I like that. That's a good point, because what you're saying is a person can have dementia and still have a good memory, in so many words. Okay.
Yes, because they might still have the brain function of memory, because whatever's causing it has not taken that from them.
Yeah.
It probably will eventually.
Yeah.
But there's different progresses, different processes, different protocols, and so everybody is different. I like to say, if you've met one person with dementia symptoms, you've only met one person with dementia symptoms.
Yeah.
So the more dementia where we become, the more we recognize we must customize and individualize our care approach. That's what's going to work.
Yeah.
And then there are other less commonly known dementia symptoms. For example, if you lose the balance and coordination, that learned brain function, then what's going to happen when you try and walk as an adult? You're going to fall more often.
Yeah.
Well, falling is a very common dementia symptom. Isn't that interesting?
Yes.
A lot of times I'll hear families tell me, well, yeah, about 10 years ago, Mom suddenly kind of got clumsy. And it's interesting that she had these unusual falls, and her gait changed.
Yeah.
Well, she could have lost that balance and coordination that she learned years ago, and she went to access that, and it becomes an issue because they fall.
Yeah, wow.
So falling can be a change of gait, any kind of change in their common personality, the way they routinely do things.
Wow.
Because you have to process that.
That's true, yeah. Yeah.
And so maybe before they read a lot.
Yeah.
But now they can't process the words on the page, so they no longer are interested.
Yeah.
Maybe there were some other activities that maybe they cooked.
Yeah.
But now they can no longer cook because they can't follow a recipe because that takes processing.
Yeah.
So there's all these different, depending on where it affects the brain, and it can affect just so many different places.
Yeah.
Then we have different dementia symptoms.
Yeah. Wow. That's interesting because, you know, well, let me say this. I'm glad that we definitely touched on the basis of the memory loss, because the memory loss is kind of the main thing that's associated with dementia. If we walk out of this room now and ask 10 people, okay, what are some of the symptoms of dementia? The first thing people are gonna say, memory loss.
Yes.
Because that's all we kind of know.
Exactly, so the other ones often go unrecognized.
That's exactly right.
Like, I'll hear families tell me, well, I'm not going to access outside help from my mom until she forgets who I am. And I'll say, oh, no, we can't wait that long, because she could have loss of good judgment. She could have loss of balance and coordination.
Yeah.
She could have loss of the ability to process where she is in any given time. She could have loss of ability to process that she's safe, and then access an unsafe situation.
Yeah, wow.
So there's so many others that are much more dangerous. However, memory loss is the one that's most quantifiable, the easiest one for us to recognize and talk about.
Yeah.
And it's a bit less invasive when we talk about it. You know, oh, okay, so I forgot. Rather than, oh, I no longer know the routine of brushing my teeth, so I can't even take care of my personal hygiene anymore.
Yeah.
I mean, that's much more painful.
Yeah.
So I think that a lot of dementia denial is based on that stigma of how horrific this is.
Yeah.
And so we don't want to face it.
Exactly. Laura, you know a lot about this. I'm curious, how and why did you get into this particular subject so intensely? Because I've known you for a long time, and you know, we just got recently reconnected, but what made you just kind of dive into this subject and just take it by the bullhorn, so to speak?
Well, let me tell you a story, and it's really important that I share this with everyone, because it really shows the negative impact that dementia has, not just on that person who has dementia symptoms, but on the family caregiver.
Yeah.
So let me tell you a story of Peggy. Many, many years ago, when Peggy was only 17, she was a shy girl. She lived in a little small town, and her girlfriends asked her to come to the regional square dance that they always had. All the little towns around the area, once a month, would get together and have a square dance. So she didn't want to go. She was shy, but they talked her into it. They got her all gussied up. She stepped into that square dance hall that night, and there happened to be a guest square dance caller from another town nearby, a young man by the name of Jack. And Peggy took one look at Jack and turned to her girlfriends and said, oh my goodness, that man is so handsome, I'm going to marry that man. And she went up and introduced herself, and she was seen talking and flirting with Jack throughout the whole evening. And before the end of that square dance that night, Jack asked Peggy out on their first date. They began to date. Over the next year, they fell madly in love. So on Peggy's 18th birthday, Jack and Peggy eloped.
Wow.
They had a long, wonderful, magical married life story. They had 5 healthy children of their own.
Nice.
And Peggy stayed home with those kids and was raising those kids, and she found she had a true caregiver's heart. So she began to invite foster children into her home to raise them alongside of her own 5 healthy children. And over the years, she raised over 20 foster children, and every one of those foster children had special care needs, and she would find a way to give them appropriate care. She managed to raise her own 5 healthy children, those 20 foster children to young adults. They began to leave the home. So Jack and Peggy began to plan for their retirement dream lifestyle. When that last adult child left the home and they were empty nesters, Jack and Peggy sold their house, bought an RV, and began to travel all over the United States. And they lived that life for 15 years. However, over those 15 years, Jack's health began to fail. First, he began to suffer with macular degeneration, so he couldn't drive, so all the driving fell on Peggy, but that wasn't her biggest concern. Her biggest concern was he began to show signs and symptoms of dementia. She worried about that. She cared for him on the road, but as he got worse and worse, she gathered him up, took him to their family physician, and they received the diagnosis that Alzheimer's was the cause of his dementia symptoms. Peggy knew enough about that. She knew it was progressive, and so it was going to get worse. So she made the conscious decision to change their lifestyle so she could step back into the role of being a caregiver, this time full time for her beloved. So they sold their RV and they bought a little house in a small town, and she stepped back into that role. And you know, Jesse, at first, Peggy was really doing well. She was a caregiver at heart, but as he continued to decline, she began to struggle managing these symptoms on her own.
Yeah.
And so she began to have conversations with her family on the phone. Now, the reason she was having them on the phone is because they were all long distance and nobody could come and help her physically. So she reached out for support on the phone and began to tell them how difficult it was. He had begun to wander and she couldn't take her eyes off of him for a minute.
Wow.
If she even went in the bathroom and closed the door for privacy, he often was out the door and down the road, and she had to call the police to come and find him and bring him back.
Wow.
She began to talk about how he wasn't sleeping at night. He was up and down and up and down, and she had to keep her eyes on him all the time. So she was literally sleeping with one eye open. She was exhausted. And he did indeed suffer from memory loss.
Yeah.
And it was just like he was on rewind. It was going backwards, and sometimes she would walk in the room and he would not recognize her. He would become extremely anxious and would not recognize her as his beloved.
Wow.
As she was sharing this with the family, they said, "Why don't you get some help in there?"
Yeah.
And she said, "You know, we made a mistake when we came here. I didn't look to see if there was dementia-aware trained professionals to help me. There's not anybody here like that.
Wow.
Jack doesn't want anybody else to help him, so he's resistant. And all of my neighbors, they're older, they can't help me. I need to just push through this."
Yeah.
So the family would say, "We'll come back and help you." And she'd say, "No, Jack and I want you to live your life. We promised you that we wouldn't interfere."
Yeah.
And so, "No, I can push through this. I'll be okay."
No.
And the family believed her. But then one night, Jesse, Jack and Peggy were home alone. Peggy had made Jack a wonderful dinner. And as she sat down to have dinner with Jack, Peggy suffered a massive heart attack. Now,
Wow.
Jack's dementia was so far advanced, he did not recognize it was an emergency.
Wow.
He eventually wandered outside and said something to a passing neighbor that Peggy was tired, she was sleeping on the floor. So by the time help arrived, it was too late. Peggy was gone. Jesse, Peggy was my mother.
Yeah. Wow.
That's how I learned this the hard way.
Yeah.
68% of the time, if that caregiver, especially if it's a same-age spouse,
Yeah.
they get sick and go first. And we must, as a society, become dementia aware. Professionals, communities,
Yeah.
policemen, firemen, everyone, we must support these caregivers. There's over 35 million worldwide that are dealing with this without this kind of support.
Yes.
That's how I got into this. And you know, Jesse, my mom's on my shoulder and she's saying, "You go, girl.
Yeah.
They need you."
Yeah, that's exactly right. Man, that's yeah, I understand. I understand. Whew. That's a deep story. That's a deep story.
It is.
For me, hearing something like that, you know, it only motivates me to want to learn more, to be honest with you. You know, I kind of, you know, did a little bit training here and there, but my knowledge, honestly, and my education on this was limited. You know,
As with most people, as with even in the medical community,
Yeah.
they don't get a whole lot of training on dementia.
yeah, yeah. And a lot of family members that has a loved one who may be diagnosed with dementia, they don't take the time to educate themselves. I know part of, well, let me say this. So in the past, I've worked for an organization where we had clients who probably about 80% of them was dealing with dementia. And a lot of the caregivers and family members, they were struggling because they couldn't understand some of the behavior, so to speak.
Right.
For example, someone may say they may be experiencing some behavior that they was still 30 years old.
Right.
And they would try to tell them, "No, you're not 30, you're 68 or you're 70. And the client that was diagnosed with dementia, they would be very adamant about them being 30 years old.
Right.
And so what happened was when the loved one or caregiver finally realized what was going on, they felt, and I specifically remember talking to one caregiver in general, and I told her, I said, "Well, you know, you have to understand this is their reality."
Right.
And she said, well, Jesse, I feel uncomfortable because I feel like if I agree to her being 30, I feel like I'm lying to her. And I'm like, no, you're not lying to her. You're just acknowledging that what she's feeling and what she's thinking in her world is true.
Right.
And that's the best way you're going to be able to help provide care for her. Right. Because if you're constantly going against what she's saying, and in her mind she thinks she's 30, then the behavior starts. And so a lot of this is going on out there, and people really don't know.
And it's so counterintuitive. It is exactly the opposite of the way that we've been taught to communicate with an adult.
Exactly.
You and I are talking, and you give me words, and those words come across the air and hit as sound waves in my ear, and my brain goes to work processing that in milliseconds to make it words and make it make sense, and I think of a response and I give that back to you. All of that takes immense processing and these brain functions that I'm talking about.
Yes.
When someone has this loss of normal brain function and they aren't able to hear it the same way, it gets a garbled message.
Right.
But they don't understand that they're not understanding it. And so it scares them and confuses them. And it's all about how that makes them feel.
Exactly.
How would it make you feel, Jesse, if I sat here and you asked me a question and I went blah, 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 blah.
Yeah, very agitated, for sure.
You'd be going, Laura, people are watching.
Yeah.
And so how would that make you feel, Jesse? You would be agitated, right?
Yeah.
Well, it's kind of a way for us to understand what it probably feels like to have this loss of normal brain function. And the dementia symptoms that they are presenting to us is they're often saying, what? And then we just give it to them louder. It wouldn't help if you said, Laura, I don't understand you. And I said, blah, 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 louder. Right. You're still not going to understand it.
Right.
So it's not just what they hear, it's what they see. And so their reality does change.
Yes.
And the way that they're interacting changes because they're not receiving the same information we are.
Exactly.
And then they're not even able to process that information. So when they send it back to us, it seems so bizarre, so different, so challenging.
Yeah.
And really all we need to do is join them what they're feeling, and then distract them with these strategies that I teach.
Yes.
And to always remember that we must think for them and not make them think. It's agitating to make them think. So with these few strategies and this different transformed dementia perspective, I can help professionals, I can help family caregivers, I can help the community, everyone who needs this information, connect and have meaningful moments with them.
Yes.
With the understanding we're not stopping, fixing, or changing anything, we're just managing it along the way to give us all more calm and peace and, like I said, meaningful and purposeful moments.
Yes, yes. I want you to tell us, I definitely want you to talk about the story about the red shoe.
Okay.
Because I think that is another story that will highlight and give people an understanding of to be more open to the reality of someone who has dementia.
And how it's all based in how they're feeling in the moment. Because our feelings and emotions remain. So I got a call from a family several years ago, and their grandmother, Grandma Lucy, had been placed into a memory care community. And Grandma Lucy had lived by herself. She was a very independent woman. And she, in her past life, she was in the fashion industry. So her past memories of herself, her value, her accomplishments all through her life were based on fashion, and she always dressed to the nines. She would never go anywhere without having shoes that matched, the gloves that matched, the hat that matched, the perfect dress. She was just, that was very important to her, her presence, her importance in life.
Yes, nice.
So she began to have a little dementia symptoms, wasn't caring for herself very well, did a little self-neglect. So the family decided to place her in a memory care community. And she also had some extreme physical challenges. She had very advanced diabetes.
Okay.
So that was also a challenge, but they found some place that was going to support her medically as well. So she was there for a few weeks, and actually she was really doing pretty well. She was blending in. They were being very dementia aware and meeting her needs and talking to her feelings and all of that and giving her the care, appropriate care. But one night she had a very catastrophic physical event. She had horrible circulation in her feet, and she didn't help that horrible circulation in her feet in the fact that she wanted to wear very stylish shoes, and sometimes they were extremely tight, and they weren't the right kinds of shoes for her, and the family had been very concerned about that. Well, one night after she had moved in, she had this catastrophic event, had to be rushed to the hospital, and the only way that they could save her life was to amputate her legs from the knee down, on both of her legs. And so they did that, and Grandma Lucy survived, and she came out of that surgery with much more confusion, but she also came out of that surgery with a very extreme, difficult, challenging behavior. So she went through rehab. They brought her back to this memory care that she had found quite comfortable before the surgery. They brought her back in a wheelchair. And her behavior that was so hard for them to understand was that she was rolling around in her wheelchair, running into the residence and saying, "You stole my shoes, give me back my shoes." And then she'd roll up to the staff and she'd say, "There's a shoe thief, they took my shoes." And the staff would try and reason with her instead of talking to her feelings and thinking for her. They would try and reason with her like we would with anyone. They tried to give her the facts, which she couldn't handle, because they'd say, "Well, you don't need your shoes anymore, honey. Remember that you had to have, you don't have any feet." And she would cry and be upset, and then she'd be right back at it, rolling around, and she was causing such a fuss that the family called me and said, "We need your help." So I came to observe her, and that's exactly what she was doing. She was just feisty little thing, chasing everybody around. "I want my shoes," and she was up all night. "I want my shoes." And "You give me back my shoes." And so I was looking at her, and what I always do is I always say, "What is she feeling?" Because the feelings are real. Doesn't matter.
Exactly.
Everything else
That's
doesn't
exactly
matter.
Right.
So, oh my gosh, she feels really betrayed, defiled. You know, those shoes were so important to her and her presence. So I talked to the family a little bit. I said, "Did you save any of her shoes?" And they said, "Well, Mrs. Dementia Whisperer, she doesn't have any feet." I said, "No, I know, but I need to know, did you save any?" And they said, "Well, yeah, we saved, we got rid of them. We didn't want her to be upset. We didn't want her to see the shoes, so we got rid of them all." And I said, "Oh, no wonder she's so upset. She came back from this catastrophic thing, and she goes and where are her shoes?" Of course, because they gave her great comfort. They made her feel good. And now she couldn't find them. So I said, they said, "Well, we saved her Christmas shoes, her red shoes. She has these beautiful pair of satin pumps, but she can't wear them anymore. They're high." I said, "Doesn't matter. And she doesn't have feet, remember?" Yeah, I know. "Can you bring them tomorrow?" And the family was okay. And so that morning I met them in the lobby, and the granddaughter had her shoes in her hand. I said, "Just keep them behind your back for a minute." And here comes Lucy, and you can hear her coming down the hall. "You stole my shoes." And she rolled up, and she was just in tears. She rolled up to her granddaughter. "They took my shoes." And the granddaughter did exactly what I asked her to do. Without missing a beat, she said, "Here they are, Grandma."
Wow.
And she took those shoes, and it was like a child on their birthday when they got their favorite present, Jesse. Her eyes were just sparkling, and she said, "My shoes.
Wow.
My shoes." It was all about, she couldn't put them on her feet, but it was about how they made her feel.
Exactly.
We were talking with a positive action. We were talking directly to her feelings. We allowed her to feel. And she rolled around. You know, some of the residents had become conditioned, and they saw her coming, and they were trying to get away. And she said, "No, look, they found my shoes."
Wow.
They found my shoes, and we put them on her end table that night, Jesse, and she fell asleep in my shoes. And it was the first good night she had. So what we need to do is get past all of the things and the events and go directly to their feelings.
Exactly.
It's so important.
Yes, it's very important. And I wanted you to share that story because I want people that actually watch this particular program to know, to acknowledge people's feelings and know that what they're feeling is real. And once you acknowledge that, then you can take a different approach to be able to support them in the areas that they need to be supported, because that's really, really important.
And it's hard to learn.
It is very hard to learn.
We overthink it. Instead of talking directly with our actions and our words to their feelings, we tend to say we reason with them. We try and help them to understand. We give them details.
Yeah.
Instead of going directly to acknowledging their feelings, agreeing with their feelings, and then taking a positive action to help distract them.
Yes, exactly. It's another one I've heard, the bath and shower thing. Talk a little bit about that. I want you to, because I want people to watch this to get some basic tips.
Yes, and I want them to understand that there has to be different strategies for everyone.
Yeah.
But the basics here are what really works, because we're going to lay the foundation of getting them to trust us by acknowledging their feelings.
Right.
And then trying different distractions, different strategies, different ways to communicate. So often, the way that we are most used to helping someone with a task is we ask for their permission. Anytime you ask a question, you make that person think of a response.
Exactly.
And it's difficult if they have this broken thinker. So what I like to say is we're going to get all questions out.
Yeah.
Because what do you think someone with dementia says to most either professional or family caregivers if they walk up? Let's just say that you were my dad, which is ridiculous because you're so much younger than me, but if you were my dad and you had dementia, and I walked up to you and I said, how would this make you feel if you had dementia, you believe you're doing just fine, you don't need my help anyway.
Yeah.
And so I walk up and I say, Dad, you haven't showered for weeks. I'm going to help you shower. Come on, would you like to take a shower? What would be the most common response with someone with dementia?
No.
No, I've already taken one.
Yeah.
Yeah, I'm doing just fine. I don't need you.
Yeah.
So I made you think, which made you uncomfortable, and you're always going to go to that negative.
Exactly.
So I've developed some strategies where what we want to do is help them feel loved, safe, secure, and valued before we ever do anything with them. And we can't do anything to them. We must do it with them.
Yeah.
So I would probably say, if I was tasked to somehow get you to shower, I would say, Dad, I'm going to pamper you. I'm going to give you a foot soak. And so I would bring you, and I'd be all prepared, and I'd bring you into the bathroom, and I wouldn't even try and get you undressed. I mean, I'm not going to make you uncomfortable. What I'm going to do is I'm going to make you feel good.
Yeah.
So I've got a bucket full of nice, soft, soapy water, and I'm going to take your shoes off, and I'm going to put I'm going to sit you down in the shower with your clothes on. Take your shoes off, put your feet in there. How's that feel? Oh, I love being with you. I love pampering you. Now, I'm not going to let you think a lot. I'm going to let you kind of enjoy that feeling.
Exactly.
So then I get ready. I'm going to move that out of the way. Oh, let me rinse your feet off. Oh, Dad, I'm so clumsy. I got your pants wet. Stand up for a minute. What do we do with wet clothes?
Yes.
I mean, that would be kind of a normal thing.
Yeah.
Here, Dad, here, hold this towel right here, Dad, because I might be talking to the modesty. Right?
Yes, exactly.
Hold the towel right here, and I'll get these wet pants off of you. I'm so clumsy.
Yes.
Here, and you know, I'm not going to give him a chance to think I'm having to help him. I'm going to give him, oh, silly me, I want to help you because I'm so clumsy.
Yeah.
I'm going to take all that on myself, and then, you know, I might rinse you a little bit underneath that, and oh, here, let me just rinse you off, and I've got some nice dry pants.
Yeah.
Well, I may only get from the waist down that time.
Yes.
I'm going to take little bites of this elephant a little at a time.
Exactly.
And get you to trust me.
Exactly.
And then this relationship, once you trust me and that you feel that my incentive is to make you feel good, then it's not going to be quite so frightening, anxiety-ridden, and you probably are not going to resist. Now, once again, that might work for Mr. Jones, might not work for Mr. Smith.
Yeah.
So we have to find different strategies, but that's our goal. We're creative.
Yeah.
We're fluid and flexible. We think for them as much as possible, as proactively, and we remember the positive action statements. It's all about how we make them feel.
Yes. Wow. Very powerful. Very powerful. Something I honestly I wouldn't have thought I would not have thought to go that route, so to speak.
And there's many other strategies that I have that I can share. I learn something new every day.
Wow, yeah.
There's so much for us to learn. Everybody's different.
Yeah.
But that's kind of the exciting part of this, is it's an adventure.
Yeah.
The dementia, and this is a key to the Dementia Wonderland, but it can be an arduous journey.
Yeah.
It's not always butterflies and cotton balls.
Yeah.
It can be challenging, but there's nothing we can do to stop it, fix it, or change it. We just need to learn to allow that person to feel,
Yeah.
and then talk to their feelings and positive action statements.
Yeah, yeah. How important is it for the caregivers to get care and just take time off from doing the caregiving work of a loved one that may have dementia? How important is it for them to get self-care as well?
Well, that's so important. Just like I talked about when I was telling the story of my mom,
Yeah.
68% of the time that caregiver gets sick and goes first.
Yeah.
It is so stressful because they are having to literally think for that person 24
Yeah.
hours a day.
Yeah.
And they have no time to think for themselves.
Yeah.
So it just wears like water on granite. You know, that it can be an iron caregiver that just has this steadfast resolve, like my mom.
Yeah. Well,
But eventually it just wears them down.
Yeah.
And there was no one around. Had I known what I know now, I would have insisted that she had help, in
That's
spite of the
awesome.
fact that, you know,
That's
often
awesome.
they say,
Yeah.
no, I don't need it, I can do it. I know better.
Yeah,
I see
exactly.
it all over the world.
Exactly.
So, you know, it's necessary to help the world become dementia aware, so that had I had the opportunity to help my mom realize how hard this was, and that
Yeah.
there were other dementia aware folks that could indeed help her,
Yeah.
I think I could have, like I said, saved her life. And so that's why the world needs to be dementia aware.
Yeah.
Everyone needs to be dementia aware. And
Yeah.
we are still way behind the curve, Jesse. It's just not done yet. We
Yeah.
have lots of work to do.
Yeah, yeah. I know a lot of caregivers and rather a loved one or paid caregivers. A lot of them feel guilty. Well, I'm talking about the loved one, feel guilty
Yes.
for stepping away from the task, so to speak, because they feel like, you know, this is a form of neglect. You know, I'm not stepping up to the plate and kind of handling responsibility. This is my mother's husband, whoever, and that's not true.
And dementia is so insidious because it shows itself, and then they're cognitive one moment, and they're themselves. And
Exactly.
so the family says, well, she's not that bad, but she can be in any given moment.
Yeah.
And so because it can happen so slowly over time, it just wears, like I said, water on granite. It just wears that caregiver down, and they don't even realize how much they're putting into this
Exactly.
until their health is affected.
Yeah.
And so becoming dementia aware helps them to all recognize that it is necessary to ask for help. One of the discussions I will have with family members who are so resistant to getting any help, I will say, okay, so we know that your loved one has loss of brain function and dementia symptoms. We know that.
Mm-hmm.
We even can do an MRI and show that there's actual loss in the brain.
Yeah.
This is insidious, it's progressive, it's permanent loss, it's serious loss, because it's so many parts of that person and that makes them human. Yet, what if the diagnosis wasn't dementia? What if it was brain cancer?
Yeah.
How would you handle that?
Yeah.
How would if you were losing them a piece at a time, but it was brain cancer, and your doctor wrote you a prescription and said they need to go to a cancer institute for
Wow.
appropriate care
Yeah.
because you can't do it at home? Wouldn't you just bring them right there?
Yeah.
We need to change our perception of asking for help with any kind of dementia care that's needed. Asking for appropriate help often is accessing in-home care, accessing
Yes.
out-of-home placement, accessing help from neighbors, from family, from friends, building your village.
Yes.
That's exactly what we should be doing, because that's the only way to get appropriate care. You
Yeah.
can't do it by yourself,
That's
just
right.
because it's so all-encompassing.
Yes.
So changing that thought that is a part of dementia denial that's so destructive to that caregiver. They have to have time to
Yeah.
think for themselves, to do the things that they love doing that they can no longer do because their spouse, their parent, their brother, whoever it is demanding all-encompassing care.
Yeah. You know, I have, I don't want to say too much because I don't want this person to be identified, but I know someone who was taking care of a gentleman that had dementia. And it became a little bit too much for the person that I know. I'm gonna call him caregiver. It became a little bit too much for the caregiver. And he became so stressed out because the person that he was taking care of, it was getting up in the middle of the night. You know, it was just a lot of different behaviors, aggressive behaviors, just a lot of paranoia, just a lot of things going on. And he became less impatient. He was not impatient at all. The interesting thing about this, the caregiver, is he is naturally a caring, loving, patient person. But I noticed that some of his natural characteristics start to change over time because he was not fully trained and he wasn't educated about how to deal with someone who had dementia. Mm-hmm. The good thing about it is the little knowledge that I knew or know, I was able to transfer that information to him and help him to understand actually what was going on. I like Sharon, one of the things that she talked about when she was doing her presentations, she gave like the onion illustration and how it peels, and you know, and so I was able to tell him that way, and he actually started to understand what I was saying, and started dealing with things in a different way.
And you see that becoming dementia aware is a process.
Yeah.
Because once you understand, you start peeling back that onion,
Yeah.
and you see what dementia is,
Yeah.
and how it's actually affecting and how it feels to that person. It gives you that natural injection, that boost of
Yeah.
empathy.
Yes.
And we all need that. Plus, then you also realize how big that onion still is, no matter how much you peel.
Yeah.
And how all-encompassing that care is. And then when you start to ask for help and fill up your cup, then you can come back and be more
Yeah.
empathetic, more patient, more calm.
Yeah.
And that's what's necessary. That's why I like to get to family members and get them to start on this road of dementia awareness. And when I say become dementia aware, that's what we have to do.
Yeah.
We become more and more dementia aware. We never get there because that person continues to change all the time.
Exactly.
So we have to be aware of this, and then we have to be aware of that. And
Yeah.
there's so many parts and pieces.
Yeah.
So helping that person to get on the road,
Mm-hmm.
then it helps to have a clear dementia view of, instead of it being a one-lane gravel road, it
Yeah.
becomes an 8-lane freeway. They still have to be watching for all the other cars. It's still not easy.
Yeah.
It's just more manageable, I guess is the way to put it, the best.
Yeah.
So
yeah.
education, becoming dementia aware, understanding that person, asking for help from all different avenues. I sit with families and just, I'll sit for 90 minutes and just counsel them and just let them vent their frustrations and share their feelings, which
Yeah.
are very normal. And,
Yeah.
and then, that's helpful, just sometimes just to be able to talk.
Mm-hmm. And it's interesting that you said that because he started to feel guilty, and he told me maybe about like 2 weeks after he started being impatient. And it was hard for him because he felt ashamed. He felt he wasn't doing a good job. But I had to explain to him, for this type of situation, you're not trained for it. Another interesting thing about it, the person that he was taking care of would get up in the middle of the night and wanted his blue blanket. Now, the person had a black blanket. And he would always say, "You got a blanket, and he didn't understand.
Right.
And what I ended up doing was I told him, I said, "Look, go and get him a blue blanket. If he does not stop this behavior, I will give you your money." And I really was going to do that. Do you know, when he got this guy the blue blanket, that stopped happening. Literally, it stopped happening that night.
Well, if we go back and think about a 1-year-old who has their favorite blanket, why do they carry that blanket around? It's all about how it makes them feel.
Exactly.
And so that person, for some reason, had that feeling trigger of a blue blanket, and that, you know, they're already feeling anxious and confused, and they just can't figure out what's going on. And if you're lost in yourself like that, you know, imagine how comforting a memory of a blue blanket might be.
Yeah, and blue was the guy's favorite color too.
Yes, and so, you know, that's also visual. You know, it's all about what we see and how that makes us feel, and what we hear and what we touch. So when we reach all of that and help them to feel loved, safe, secure, and valued, that blanket, that's what that gave to him in the moment.
Yes, exactly.
So why not?
Yeah, exactly, exactly. So let's talk about, so is dementia a mental health issue?
Well, a mental health issue like schizophrenia or any of those others, they are affecting the brain, but in a very different way. And those can be stopped, fixed, or changed with cognitive therapy or medications. And so we see things that might resemble or maybe cross a little bit about dementia symptoms with mental illness. But the difference is that someone who has permanent and progressive loss and is showing these dementia symptoms, there's no cognitive therapy that's going to make that better, because you have to be able to process. And so most frequently that processing portion isn't affected with mental illness. And so we can touch that and use that to do some therapy or medication changes, or you know, some talking therapy, whatever helps that. But with dementia, it's gone. There's nothing we can do but help manage the symptoms. So that's the difference. And now there's kind of some real confusing things going on with the medical community and the psychological community, a psychiatric community, because one of them says, no, that's a health issue, and the other one says, no, that's a mental health issue. And so people with dementia often fall in the cracks. For example, because it's not considered really a physical issue, although it is, but it affects your mental health as well, or your mental ability, I guess is what I need to say. Health insurance won't pay for it, but really? So it's all private pay or long-term care pay.
I didn't know that. Interesting.
And so you know, there's this kind of this ball keeps getting thrown back and forth, because the psychiatric psychology industry, what they're saying is it's physical, and over here they're saying no, it's mental, and so nobody's picking up the tab. And there's not a lot of people that understand dementia awareness, even in the medical field, to help these families understand in the way that you and I are talking about as well. So they're not, everywhere they go, it's like a maze of trying to get the resources that they need.
Wow, interesting. And I like the fact that you made that point, because a person that may have memory loss or confusion or a sudden mood change in their behavior, you know, it could kind of go on either spectrum with dementia or bipolar or schizophrenia and things like that, which is, man, it's interesting.
And there are some markers that kind of make a difference, but you know, we're playing with how people feel and how they process, and you know, there's those challenges, for example, with schizophrenia too.
Yes.
But there's medications that can help to balance that, and right now there's just not anything for any cause of dementia. You know, I am so anxious for there to be a cure, but that's the hard part too, because let's just say that tomorrow there is a cure for Alzheimer's. Well, there's 99 other causes waiting in the background. That's why this is such a runaway train, such a silent pandemic. And when you reach the age of 70, you have a 50% chance of having one of these causes.
Wow.
So that means between you and I, if I invite you to my 70th birthday party, which is coming up faster than I'd like to admit, if I invite you to that and there's two of us there, one of us is going to have dementia and the other one's going to be caring for somebody who has it.
Wow.
And yet there's no cure. There's no medications, And the other part about this is most of these causes are very slow progression. So by the time that person is even diagnosed with whatever's causing it, Alzheimer's, for example, they've had it in their brain for 10 to 15 years before it ever is bad enough loss to show.
Yeah.
And so if we're going to come up with some wonderful, miraculous vaccine, we're going to all have to get it when we're in our 20s or 30s.
Yeah.
It's too late for you and I.
Yeah. Yeah. Wow.
And isn't that sad? It's so scary.
Yeah.
But there's this huge societal stigma about it. It is horrific.
Yeah.
But there's also this awful stigma that I hear sometimes, which just makes my skin crawl. Well, that only happens to older people. They've already had their life.
Yeah.
But it's happening to us much younger.
And exactly. And that was the next question I was about to ask you. What is the youngest age that you know of that a person who has been diagnosed or showed the symptoms of dementia?
Well, it depends on the cause, because most of the causes, like I said, they really start to show dementia symptoms between 65 and 75. That's when we really see them. But remember, that person has already had it in their brain for several years before that.
Yeah.
But there is some causes that start much, much younger.
I believe that.
Like young onset Alzheimer's is a different strain of the Alzheimer's disease.
Yeah.
And it can start in someone's brain. I've worked with people that were 30, 35.
And you know what, Laura, and the reason why I asked you that was because I know people personally that are like 29, 30, and like just memory loss. I mean, not just very, very, very forgetful. And for me, because I know a little bit about this stuff and that stuff, or, I sit back and I'm very observant, like, wow, like this is, but, it's a joke. They laugh, like, but I think to myself, like, wow, this can be something that's there.
It can be there. And I like to, people often ask me, well, I forget things. Does that mean I have dementia?
No.
And I'll say, well, let's talk about that, because it's so much deeper, like I said, than memory loss.
Yeah.
So let's just say you have a habit when you come in the house of throwing your keys on the counter right by the back door. Because you come in through the garage, you throw your keys on the counter. So then when you get ready to go out again, you're walking through that door and you're late. Let's just say you're late and you go to pick up your keys and your keys aren't there.
Yeah.
And what do? You start to think about, why did I change that routine? So you start to process previous information. So you are forced to access memories of what you backtrack.
Yes, absolutely.
And so maybe it was cold outside, and so you had your jacket on and you brought in groceries, and so when you were carrying your groceries, you just dropped your keys in your pocket, which was unusual, but because of the circumstances. But you have to go through your coat closet and think, maybe I put them in here, and then you find them and you process why there was a change.
Yes.
What I want people to be worried about is if they can't find their keys, they can't even process why they're going out. So when they don't find them immediately, they just go into another room and start doing something else. And then they decide they want ice cream. So they go to the freezer and they open it and their keys are in there, and they pick them up and they look at them and they can't even process what they're for anymore.
Yeah.
It's much deeper than just forgetting.
Yes.
It's not being able to process what is happening around you and what to do about what is happening.
Yeah.
That's much deeper than just occasional memory loss.
Yeah. That's interesting. That's interesting, because I think about even myself today. I was making sure that I take my work laptop, and when it came to my mind, boom, I got it. I took it downstairs. I went in the garage, put it in my car, and went back up. Because I've forgotten about it before.
Yes.
But when it came to my memory, I'm like, just so I won't forget it, because I'm just all over the place getting ready in the morning, I'll make sure that this is secure.
Yes, because you go to access those memories, and it's like you're so busy that you didn't file them real well. They're kind of out of control.
Yeah.
And so you have to be mindful and make sure that you're thinking in a certain, but you're still able to process.
Yes.
That's what you have to always encourage yourself. I can still process, so it's not loss of processing.
Exactly. That's really good. That's really, really good. Right quick, I want to talk a little bit about our dementia. Do you think dementia patients are aware that they have dementia?
that's kind of a long,
Okay.
drawn out thing. So
We got
maybe.
2 minutes.
Okay.
All right.
So maybe. So the very portion of our brain that knows whether we're impaired or not is often greatly affected by most of the causes of dementia.
Okay.
So a lot of times, about 90% of the time, someone who has this loss of normal brain function has lost that ability to know they have,
Okay, wow.
that they're impaired.
Okay.
Alcohol does that to us, actually. You know, you drink too much alcohol. Let's just say you and I went to a party, you drink too much alcohol, and you want to drive home, and I said, no, you're drunk. What are you going to say to me?
No, I'm
No,
not.
I'm not.
No,
I feel perfectly normal.
Yeah.
That's because that portion of your brain that would know you're impaired is dulled by alcohol. Unfortunately, dementia robs it permanently. It's called anosognosia. I talk a lot about it in my book.
Okay.
But it is a dementia symptom that we deal with, and it's dangerous because they truly believe they are normal and can access normal brain function and do things that they've done in the past, and they cannot.
Okay.
Yeah.
Okay. Well, Laura, we have run out of time.
Oh
and
my gosh.
I know I told you it was gonna go quick. And thank you for being on the show.
Thank you.
And that's it for this edition of Mental Health Matters. If you enjoyed this particular show, or if you would like a copy of this particular show, or if you would like to be a guest on the show, please dial 916-366-4600. Thank you.